The topic of the tutorial is triangles and muscles of the neck. I, Dr. Alpana Kesar, will be covering this topic under the following subheads: anterior triangle of the neck with its four subdivisions, that is submental, submandibular, carotid and muscular triangle; posterior triangle with its two subdivisions, that is occipital triangle and supraclavicular triangle; suboccipital triangle. Following muscles will be covered: sternocleidomastoid, trapezius, suprahyoid and infrahyoid muscles, and scalene muscles. For the descriptive purpose, the neck is divided into anterior triangle and posterior triangle. The boundaries of the anterior triangle are the anterior border of sternocleidomastoid muscle, the midline of the neck, and the lower border of mandible. The boundaries of the posterior triangle are: anteriorly, it is bounded by the posterior border of sternocleidomastoid. Posteriorly, it is bounded by the anterior border of trapezius. And inferiorly, it is bounded by middle one-third of clavicle. Anterior triangle of the neck. The anterior triangle is further subdivided into four triangles. This is the submental triangle. This is the digastric triangle, also known as submandibular triangle. This is the carotid triangle. And this is the muscular triangle. The submental triangle is a single triangle in the midline, while the digastric, carotid, and muscular triangle are paired triangles with one on each side. Submental triangle. Submental triangle is a single unpaired triangle which is present in the midline. It is bounded laterally on both sides by the anterior belly of digastric. Inferiorly, it is bounded by the body of hyoid bone, and its apex is at symphysis mentae. The contents of the submental triangle are submental lymph nodes and the tributaries of the veins that forms the anterior jugular veins. Submandibular triangle, also known as digastric triangle. This is the submandibular triangle. It is also called digastric triangle. It is a paired triangle with one triangle on each side. It has a superior boundary and two inferior boundaries. This is its anteroinferior boundary and this is its posterior boundary. Its superior boundary is formed by the lower border of mandible. Anteroinferior boundary is formed by the anterior belly of digastric and the posterior boundary is formed by the posterior belly of digastric. The contents of the digastric triangle are the submandibular salivary gland, submandibular lymph nodes, facial artery and facial vein, hypoglossal nerve, and mylohyoid nerve. Carotid triangle. This is the carotid triangle. Carotid triangle is a paired triangle with one present on each side. The boundaries of carotid triangle are: this is its superior boundary, this is its anterior and posterior boundary. The superior boundary is formed by the posterior belly of digastric. The anterior boundary is formed by the superior belly of omohyoid. and the posterior boundary is formed by the anterior border of sternocleidomastoid. The contents of the carotid triangle are: the common carotid artery terminates in the carotid triangle into its two terminal branches, namely external and internal carotid arteries. Branches of external carotid artery, namely superior thyroid, ascending pharyngeal, lingual, facial, and occipital arteries. Common facial vein and its termination into internal jugular vein. Both the structures, that is common facial vein and internal jugular vein, forms the contents of the carotid triangle. Cranial nerves, namely 10th, 11th and 12th, and cervical branch of facial nerve are all the contents of carotid triangle. Yet another content of carotid triangle includes cervical nerves, that is, superior and inferior roots of ansa cervicalis and transverse cervical nerve. Muscular triangle. Muscular triangle is a paired triangle with one triangle on each side. The boundaries of the muscular triangle is: medially is the midline of the neck, superiorly is the hyoid bone, laterally the boundary is formed by two muscles: the superior belly of omohyoid above and the anterior border of sternocleidomastoid below. The contents of the muscular triangle are four muscles, and they are sternohyoid, sternothyroid, thyrohyoid, and omohyoid, which is both the boundary as well as the content of the muscular triangle. Other than these four muscles, two glands, that is, the thyroid and the parathyroids, also form the contents of the muscular triangle. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Posterior triangle of the neck. This is the posterior triangle of the neck, which is present on the lateral side of the neck. The structures in the posterior triangle of the neck is in direct continuity with the structures going in the upper limb. Boundaries of the posterior triangle. The anterior boundary is formed by the posterior border of sternocleidomastoid. The posterior boundary is formed by the anterior border of trapezius muscle. The inferior boundary or the base is formed by the middle one-third of the clavicle. Apex is on the occipital bone where the attachments of sternocleidomastoid and trapezius comes together, which is just behind the mastoid process. The roof is formed by the investing layer of deep cervical fascia, and the floor is formed by the prevertebral layer of cervical fascia covering the following muscles: splenius capitis, levator scapulae, posterior, middle, and anterior scalene muscles. Subdivisions of posterior triangle. Inferior belly of omohyoid cuts across the posterior triangle, dividing it into two parts: a larger upper part and a smaller lower part. The larger upper part is the occipital triangle and the smaller lower part is the supraclavicular triangle. Contents of the posterior triangle. First, we will do the contents of the occipital triangle. The contents of the occipital triangle include spinal accessory nerve. Spinal accessory nerve is the 11th cranial nerve which runs from the deep surface of sternocleidomastoid to the deep surface of trapezius muscle. Spinal accessory nerve supplies both sternocleidomastoid and trapezius muscle. Cutaneous nerves, which are the branches of cervical plexus, are also present in the occipital triangle and emerge from the posterior border of sternocleidomastoid. The cutaneous nerves present in the occipital triangle are lesser occipital nerve, great auricular nerve, transverse cervical, and supraclavicular nerves. Muscular branches to levator scapulae and rhomboids are present. Upper part of brachial plexus is yet another content of the occipital triangle. Blood vessels present in the occipital triangle are the occipital artery and the transverse cervical artery. Lymph nodes present in the occipital triangle include supraclavicular lymph nodes and the occipital lymph nodes. Contents of the supraclavicular triangle. Supraclavicular triangle is much smaller as compared to the occipital triangle, but supraclavicular triangle contains some major contents. The contents of supraclavicular triangle are the three trunks of brachial plexus are present in it. Nerve to serratus anterior, subclavius, and suprascapular are present in the supraclavicular triangle. Blood vessels present in the supraclavicular triangle are the subclavian artery and the subclavian vein. External jugular vein is also present, which terminates into the subclavian vein. Transverse cervical artery and vein and suprascapular artery and vein are yet other contents of the supraclavicular triangle. Supraclavicular triangle also contains supraclavicular lymph nodes. Suboccipital triangle. This is the suboccipital triangle. In this visual, this is the suboccipital triangle, which is bounded supromedially by rectus capitis posterior major and minor. Supralaterally, it is bounded by superior oblique capitis, inferiorly by inferior oblique capitis. The roof of the triangle is formed by semispinalis capitis and longus capitis muscle. The floor is formed by the posterior arch of atlas and the posterior atlanto-occipital membrane. The contents of the triangle are the third part of the vertebral artery, which appears in the triangle before entering the foramen magnum. Dorsal ramus of the first cervical spinal nerve appears in the triangle, which also supplies the muscles that forms the boundary of the triangle. The suboccipital plexus of veins is present in the triangle that drains the occipital vein and the muscular veins in this region. Muscles of the neck. Sternocleidomastoid. Sternocleidomastoid muscle is a key muscle of the neck that has origin from two different bones, a sternal head and a clavicular head. Sternal head is a rounded tendon which arises from the anterior surface of the manubrium of the sternum. Clavicular head is a fleshy aponeurotic fiber containing head that arises from the superior surface of the medial one-thirds of the clavicle. Insertion is in the lateral half of the superior nuchal line and also on the lateral surface of the mastoid process. Nerve supply is by spinal accessory nerve, which is the 11th cranial nerve. Innervation is also by branches from anterior rami of the second and the third cervical spinal nerves. Action of sternocleidomastoid muscle is when the muscle of one side acts, it will tilt the head towards that side and turn the face towards the opposite side. When the muscle of both sides act together, it will draw the head forwards. Clinical anatomy of sternocleidomastoid. Wry neck. Wry neck is the deformity of the neck caused by shortening of the sternocleidomastoid. This occurs when the muscle is damaged, which occurs most frequently at the time of labor. This is caused by excessive stretching of the muscle fibers that results in damage to the muscle. Spasmodic torticollis is painful contraction of sternocleidomastoid muscle caused by exposure to cold or maladjustment of the pillow. Sternocleidomastoid muscle is a key muscle of the neck that has important structures related to it, structures which are present superficial or over it. From outside to inside are the skin, superficial fascia, platysma muscle present in the superficial fascia, investing layer of the deep cervical fascia, external jugular vein, and the great auricular nerve. The structures present deep to it or below it include the carotid sheath, the common carotid artery, the external carotid artery, internal carotid artery, internal jugular vein, and the vagus nerve. Structures which are related to its posterior border are the cutaneous nerves which emerge from its posterior border and include the lesser occipital nerve, the great auricular nerve, the transverse cervical, and the supraclavicular nerves. Trapezius is a large trapezoid-shaped muscle that is present in the back. Origin of trapezius is from the superior nuchal line, external occipital protuberance, ligamentum nuchae, and from the spinous process of the vertebra 7 cervical to the 12 thoracic vertebrae. Insertion is in the lateral one-thirds of the clavicle, in the acromion process, and also in the spine of scapula. Nerve supply is by the spinal accessory nerve, which is the 11th cranial nerve. Proprioceptive fibers are received from the third and the fourth cervical nerves. Function of trapezius is that it assists in rotating the scapula during abduction of humerus above the horizontal. The upper fibers of trapezius and the lower fibers of trapezius will act on scapula to rotate it so that the overhead abduction of arm can be carried out. Suprahyoid and infrahyoid muscles. Muscles that are present in the anterior triangle are divided or classified into two according to their location relative to hyoid bone. Muscles which are present above the hyoid bone are called suprahyoid muscles, and muscles which are present below the hyoid bone are called infrahyoid muscles. Suprahyoid muscles are mylohyoid, geniohyoid, anterior and posterior bellies of digastric, and stylohyoid muscle. Infrahyoid muscles are sternohyoid, omohyoid, sternothyroid, and thyrohyoid. Mylohyoid muscle. Mylohyoid muscle, which forms the floor of the mouth, is also called oral diaphragm. Its origin is from the mylohyoid line, which is present on the inner surface of the body of mandible. Insertion of mylohyoid is the lower fibers get inserted in the body of the hyoid bone. The upper fibers get inserted into the midline raphe. This midline raphe is formed by intersection of the fibers of mylohyoid muscle on right and left side. The action of mylohyoid muscle is elevation of the floor of the mouth, which takes place at the time of swallowing. It also helps in the elevation of hyoid bone. Nerve supply of mylohyoid muscle is from inferior alveolar nerve. Inferior alveolar nerve, just before it enters the mandibular foramen, gives nerve to mylohyoid, which supplies mylohyoid muscle and gives a branch to the anterior belly of digastric. Inferior alveolar nerve is a branch of mandibular nerve. Geniohyoid is a ribbon-shaped muscle. Its origin is from the inferior genial tubercles present on the inner surface of the body of the mandible. Insertion is into the body of the hyoid bone. The action of the muscle is when the hyoid bone is fixed, it helps to pull the mandible down. Thus, it helps to open the mouth. When the mandible is fixed, it helps to elevate the hyoid bone. The innervation of geniohyoid muscle is by branch from anterior ramus of C1. The fibers are distributed by hypoglossal nerve. Digastric muscle. The word digastric means two bellies. Digastric muscle has two bellies, namely the anterior belly and the posterior belly of digastric. This is the anterior belly of digastric and this is the posterior belly of digastric. The anterior belly of digastric take origin from the digastric fossa, which is present at the lower surface or border of the body of mandible. The posterior belly takes origin from the mastoid process on its medial surface and from the mastoid notch. The anterior belly from the digastric fossa and the posterior belly from the mastoid process both will descend down towards the body of the hyoid bone. Both the muscles get inserted into the common tendon. This common tendon is held in place with the help of connective tissue fibers that form a sling or a pulley around the common tendon. This pulley is attached to the body of the hyoid bone. When the muscle contracts, it pulls the body of the mandible downwards, thus helping in the opening of the mouth. This muscle also helps to elevate the hyoid bone. Digastric muscle has dual innervation. that is, anterior and posterior bellies, are supplied by different nerves. Anterior belly of digastric is supplied by mylohyoid nerve. Mylohyoid is a branch of inferior alveolar nerve, which is a branch of mandibular nerve. The posterior belly is supplied by facial nerve. Hence, the anterior and the posterior bellies of digastric are supplied by trigeminal and facial nerve respectively. Suprahyoid muscles. In suprahyoid muscles, this muscle is stylohyoid. Stylohyoid muscle takes origin from the base of the styloid process, and it gets inserted into the body of the hyoid bone. The muscle pulls the hyoid bone upwards and is innervated by facial nerve. Infrahyoid muscles. Sternohyoid. This muscle is sternohyoid. Sternohyoid takes origin from the manubrium of the sternum and gets inserted in the body of the hyoid bone. Action of sternohyoid is to depress the hyoid bone. This muscle is omohyoid. Omohyoid has two bellies. This is the superior belly of omohyoid and this is the inferior belly of omohyoid, both of which are connected to each other with the help of intermediate tendon. Origin of omohyoid muscle is from the superior border of scapula and insertion is in the lower border of the body of the hyoid bone. Action of omohyoid is to depress the hyoid bone. Innervation or nerve supply of both the muscles is through ansa cervicalis. Branch of ansa cervicalis which distributes the fibers of first to third cervical spinal nerves supply both sternohyoid and omohyoid muscles. Further, we will do two more infrahyoid muscles, namely sternothyroid and thyrohyoid. This is the thyroid cartilage and this muscle is sternothyroid and this one is thyrohyoid. Sternothyroid takes origin from the posterior surface of the manubrium of the sternum and gets inserted in the oblique line of the lamina of the thyroid cartilage. Its action is it draws the larynx and the thyroid cartilage downwards. Nerve supply is through ansa cervicalis, the branch which distributes the fibers from first to third cervical spinal nerves. Thyrohyoid muscle. This is the thyrohyoid muscle that takes origin from the oblique line of the lamina of the thyroid cartilage and gets inserted in the greater horn and the body of the hyoid bone. It helps to depress the hyoid bone. When the hyoid bone is fixed, it helps to raise the larynx. Innervation of thyrohyoid is from the anterior ramus of first cervical spinal nerve whose fibers are distributed to the muscles via hypoglossal nerve. Scalene muscles. Scalene muscles are those muscles that are present on the side of the neck. There are three scalene muscles: scalenus anterior or anterior scalene muscle, which is this, middle scalene muscle or scalenus medius, which is this, Here, this is scalenus medius and scalene posterior muscle or scalenus posterior, which is this. Of these three, scalenus medius is the largest. Scalenus medius is the largest muscle, but scalenus anterior is considered as the key muscle because major structures like subclavian artery and vein are related to it. All the scalene muscles take origin from the transverse process of the cervical vertebrae and get inserted into the first two ribs. The function of scalene muscles is to bend the neck laterally, that is on the right and the left sides. Next, we will do the origin, insertion, nerve supply, and action of all the three scalene muscles. Before that, let us try to understand the structure of a typical cervical vertebra. This is the transverse process of the cervical vertebra, which has an anterior tubercle and a posterior tubercle. The scalenus anterior muscle takes origin from the anterior tubercle of the transverse process, while the scalenus medius and scalenus posterior takes origin from the posterior tubercle of the cervical vertebra. Scalenus anterior muscle, which is this, takes origin from the anterior tubercle of the transverse process of third, fourth, fifth, and sixth cervical vertebra. It gets inserted into the scalene tubercle of the first rib. Nerve supply is from the ventral rami of C4, 5, and 6, that is 4th, 5th, and 6th cervical spinal nerves. Scalenus medius takes origin from the posterior tubercles of the 3rd, 4th, 5th, 6th, and 7th cervical vertebrae. It gets inserted on the superior surface of the first rib. It receives its nerve supply from the ventral rami of 3rd to 8th cervical spinal nerves. Scalenus posterior muscle takes origin from the posterior tubercles of the transverse process of 4th, 5th, and 6th cervical vertebra. It gets inserted on the outer surface of the second rib and receives its innervation from the ventral rami of 6th, 7th, and 8th cervical spinal nerves. The action of scalene muscles, that is all the three scalene muscles together, helps in the lateral flexion of cervical spine. That is, it helps to bend the neck laterally on right and left sides. Scalenus anterior muscle is considered as a key muscle of the neck because of some important relations to it. The subclavian vein, along with the phrenic nerve, internal jugular vein, and sternocleidomastoid, pass anterior to it, and subclavian artery, along with the brachial plexus, passes posterior to it. Questions that may be asked from the topic triangles and muscles of the neck in the examinations include short notes on submental triangle, submandibular triangle, carotid triangle, and muscular triangle. Out of this, submandibular triangle and carotid triangles are asked more frequently. Anterior triangle, which includes all these four triangles, may be asked as a major question. Posterior triangle may be asked as a short note or a major question. Suboccipital triangle is asked as a short note. Short notes may be asked on sternocleidomastoid muscle, trapezius muscles, suprahyoid muscles, infrahyoid muscles. Any one of the suprahyoid or infrahyoid muscle may be asked as a short note. Scalene muscles may also be asked as a short note.